Jeff's second roundtable discussion with the panel is coming up in about 15 minutes. Only 5 of 14 hospitals in New Mexico are compliant with a 2021 federal rule on price transparency. That's according to a July report from the nonprofit Patient Rights Advocate. The rule requires hospitals to post 5 different standard charges for common medical procedures that they offer. Hospitals must also provide patients with a tool to browse at least 300 shoppable procedures. It's a complex issue, so this week I caught up with the founder, chair, and CEO of the group, Cynthia Fisher, to learn how access to these prices can give patients more power over their care. Cynthia Fisher, thank you for joining me today on New Mexico in Focus.
My pleasure.
Now, your group issued a report this summer listing the number of hospitals that aren't complying with the federal hospital price transparency rule. Before we get into that and what your report found, can you tell me a little bit about the rule itself, what it requires, and what it's supposed to provide for patients?
Yes, hospital price transparency and the rule for all prices to be shown by all hospitals wherever we get care is truly transformative. Why? Because it shifts power to the patients to know prices up front and to have prices when we get our medical bills to make sure we're not overcharged. Price transparency shifts power to the patient to lower the cost of healthcare by making sure with prices we're not overbilled and by being able to shop in advance of care.
What about for people with specific insurance plans? Are hospitals supposed to be providing that specific price in those scenarios too?
Yes, all prices at every hospital are to be posted online, comparing the discounted cash price to all negotiated rates by every insurance carrier in every single health plan that hospital accepts. Prices vary greatly, even in the same hospital. You can see one patient pay up to $6,000 for a C-section, for instance, and another woman the same day by the same surgical team may pay over $60,000 for her C-section by the same codes in the same hospital. There's wide price variation by different insurance carriers. And now by seeing these prices, we can see, wait a minute, is our health plan providing an appropriate and fair price compared to other plans? Or is the cash price even far cheaper that it makes sense to pay cash out of pocket and be reimbursed?
Okay. Now, as for your report from Patient Rights Advocate, can you explain how you investigate a hospital's compliance with this price transparency rule and how you determine whether or not a hospital is following those requirements?
Yes. Our organization, patientrightsadvocate.org, our data team looked at every requirement of the rule for all prices to be posted by every payer and plan for that given hospital and the cash price. And so we just simply took the requirements of the rule and compared what the hospital data file posted online is doing in compliance. And we found that, unfortunately, only 36% of the nation's hospitals are fully compliant with the rule showing all of their prices. That means the rest have some type of file, however, they're incomplete, and they make it unusable for patients to seek what are the different prices they would be paying for care and coverage.
Now, that 36% that you just mentioned of the 2,000 hospitals that you sampled, or your group sampled, it's up from 16% last year. It's a significant increase, but obviously still well short of 50%. Why are those numbers still so low?
The numbers are full compliance by the hospitals are better than last year. However, being that it's just nearly over a third of the nation's hospitals fully compliant, it's really been slow walked by the industry, because as long as hospitals and insurance companies hide their prices, they can charge whatever they want. And price transparency shifts power to the patients to be protected from being overcharged. And it shifts power to the patients to be able to shop up front and seek the best quality of care at the lowest possible price. So why also are hospitals not fully compliant is that the Health and Human Services federal government has not been robustly enforcing the hospitals to comply with this law. With thousands of hospitals across the country not in complete compliance, only 13 hospitals have been fined in the past 3 years for not showing their prices. That's a minimal amount and has not affected change. However, the fines, with over $1 million in monetary fines and penalties, quickly get those hospitals into compliance. Within weeks, we see those hospitals that have been fined that amount end up having exemplary files and then comply with the law.
Why do you think that enforcement is lagging behind, as you say it?
The lawyers and the lobbyists of the insurance industry and the hospital industry have been fighting and even suing in the courts to prevent having to show their prices, and they lost. They lost in the courts. And it is a patient's right by law now to know all prices up front in advance of care. Additionally, every single employer and union health plan has the right to know all prices and also get receipts of payment, which is called their claims data. And even that has been withheld by the big Blue Cross, Uniteds, Cignas that have been reluctant to provide the actual billing receipts as well as the pricing data to employers so that they can create health plans and give incentives to their workers to help save money and put more bonuses and money into their paychecks and wages by being able to save on healthcare coverage costs as groups.
Now, looking back here in New Mexico, our state, according to your report, is in the middle of the pack, ranked 25th with that nationwide number, 36% of hospitals compliant. The most common issue that your report found with hospitals in our state is a lack of negotiated rates, both for minimum and maximum charges, as well as identifying specific plans for all commercial payers. Are there any specific groups of people who are impacted more than others by vague or incomplete pricing information?
Absolutely. All constituents in New Mexico are harmed when they can't get a price from a hospital in advance of care. It prevents them, by not seeing prices, it prevents them from finding out where they can get an MRI for $300 versus paying over $3,000 for an MRI in a hospital system that might be opaque. So when you can see this wide price variation and know that you can get the same quality at a far lower price, it allows patients throughout New Mexico to be able to take care of their health care with financial certainty at prices they know they can afford and prevent coming to hospitals in crisis. Outcomes will be better, care will be better. However, when any patient doesn't get a price, they're also harmed when it comes to the time they get their medical bills in the mail. Do you realize that in New Mexico, patients are being sued by hospitals and taken to court and having their wages garnished and also having liens put on their homes for overcharges? Many times these medical bills are way overcharged by both the insurer and the hospital. But prices now give all New Mexicans the ability to fight in the courts, because no one should have to go to medical debt without that hospital providing all of the data by every single code as to what the actual prices are, so that patients can analyze their medical bills and stand up for themselves to not go into medical debt if they've been overcharged or have errors or even fraudulent billing. This price transparency now in New Mexico is a total win for consumers, and everyone needs to know they shouldn't pay the bill unless they actually have a price comparison to their health coverage or their plan and the cash price to see if they've been appropriately charged.
Now, for those hospitals that are either partially or fully compliant, do you think the pricing information is presented in a clear or easy to read way, easy for just a regular person to digest when they look? Or is that a separate hurdle for both hospitals and for patients looking for that information?
Well, most individuals can read a spreadsheet or columns and rows to compare prices. We do it in our everyday lives in every other market. The problem right now is that many of the hospitals are not putting their pricing files in a standard spreadsheet format, and they're obfuscating or putting hurdles by creating complicated files or files that aren't easily downloaded by most consumers or easy to open on any of our computers. That's a form of obstruction, and it prevents true prices from being known. And what we now are encouraged by is there are steps in the federal government to create a standard pricing file across all hospitals so that it'll be much easier for consumers to pull down these files. And then you can imagine once everything's standardized and there are more than 50% of the hospitals in full compliance, we will have a tech industry creating shopping tools for our cell phones to shop for colonoscopies or MRIs or even childbirth online on what does it cost to have a baby? What does it cost to have a strep test? Where can I get the closest MRI at the best price? Much like we have with airlines like Expedia or Kayak or Google Flights, you can imagine that these types of tools would be available for us to compare where to go, what hospitals, what standalone centers, doctor's offices where we can get access to care at prices in advance that we know we can afford.
Now, this week we went looking to find out exactly how easy or difficult it is to find a price and compare it for one of the more common medical procedures. We looked for the price of a colonoscopy, like you just mentioned, and of the 6 Albuquerque-based hospitals included in your study, only the University of New Mexico Hospital had every price option required to meet the hospital transparency rule. With that information, we were able to look, and we found 46 different payment options at UNMH, ranging between $380 and $1,900. Does that surprise you that
Wow.
UNMH was the only one that had that available?
Well, sadly, that is the case that we're finding across the country, that only 36% of the nation's hospitals are fully complying. But look at the data you found. You found a big price range of variability for a little under $400 to over $1,900 for the same exact procedure in the same hospital and the same hospital system. So we applaud the University of New Mexico for being a leader and enabling patients to trust the hospital to at least provide these different prices and to be able to see what they can get and at what price. The rest of the hospitals would be well served if their leadership, that goes to the CEOs and the CFOs, did the right thing and abided with and obeyed the law, which is to show all patients prices. Let me give you another example. Why? In Carlsbad, we found a report from Johns Hopkins University that 1 in 5 members of Carlsbad community have been sued by the local Carlsbad hospital. Getting prices by the Carlsbad Regional Hospital gives those individuals who are taken to court to have their garnished wages or liens on their home now have the right to get from Carlsbad Hospital the prices and compare it to their bills to make sure that they haven't been overcharged. And in the future, it also lets them go on any other medical care to make sure that they can shop in advance of getting their care and not go where they've been overcharged in the past.
Do you think that the hospitals around the state that don't have this information available are on the right path to get it some point soon? And what advice would you have for patients in the meantime?
Our advice is to go to the hospitals that are showing their prices where you can print out and get that fair market price in advance of care. When we sign in to get care, oftentimes, in almost every circumstance, we're signing in a blank check, a personal guarantee that we will pay that hospital whatever they choose to charge us for that procedure. Well, if you come in with a price on your plan at other hospitals, you'll know what to write in to say not to exceed the price that my insured rate is for that colonoscopy procedure. That puts a stop limit on being overcharged. And we have that right by law. If that hospital isn't showing the price, then to demand that hospital, even when on site, to provide a printout of the actual prices for your procedure before you sign on that dotted line. You have the right to know all prices in healthcare before you get care. You have the right to have these prices before you pay any of those medical bills to make sure your bills are correct. And too often, patients are overcharged by both their insurers and by the hospitals, and they're surprised by those bills.
Cynthia Fisher, thank you so much for joining me here on New Mexico in Focus.
Thank you so much, Lou.
Thank you to Cynthia Fisher for making time to talk with us about hospital pricing transparency here in New Mexico. As we mentioned, during that interview, only 5 of 14 hospitals in our state are compliant with that federal rule. Here they are: Carlsbad Medical Center, Eastern New Mexico Medical Center in Roswell, Los Alamos Medical Center, Mountain View Regional Medical Center in Las Cruces, and UNM Hospital in Albuquerque. As for the 9 remaining hospitals that still aren't compliant with that 2021 rule, there's Christus St. Vincent Regional Medical Center in Santa Fe, Covenant Health Hobbs Hospital, Lovelace Medical Center in Albuquerque, Lovelace Regional Hospital in Roswell, Lovelace West Side Hospital in Albuquerque, Lovelace Women's Hospital in Albuquerque, Memorial Medical Center in Las Cruces, Presbyterian Hospital in Albuquerque, and the Heart Hospital at Lovelace Medical Center, also in Albuquerque. For more information on the hospital price transparency rule, we have links to the report by Patient Rights Advocate posted on our social media pages and under this video on the New Mexico in Focus YouTube page. Now, back to executive producer Jeff Proctor and our panel with reaction to some of the other mandates included in the governor's public health order and a conversation on whether more cops will help blunt gun violence in Albuquerque.